talk about on my show a little bit about media literacy. When we live in a world where we know that billionaires have a message that they want to tell us, and billionaires will tell that message to us through the media, we need to be very critical of media. We need to really look at headlines with a grain of salt. And when we see something very fishy, well, it's probably too good to be true. COVID, flu, and RSV declining in hospitals as triple-demic threat fades. Now, I want everyone to look at their calendars, right? Maybe you don't have a calendar. It is the year 2023 after all. But open your phone and tell me, what is the date today? Well, as of this video recording, it is January 23rd, right? So let's look. So many patients sick with RSV had inundated Connecticut's... Max, what the fuck are you doing? This dog. Connecticut's children's medical facility that they had to be treated in hallways and playrooms facing their busiest season in memory last fall. Hospital leaders floated a plan to enlist the National Guard to help set up tents outside. Doctors braced for a dire winter looming disaster, some dubbed the triple-demic, with flu season revving up, coronavirus roaring back, and holidays providing fuel for viruses to spread. But no such surge materialized. The RSV wave had receded in Connecticut and across the country. Flu cases had rapidly dwindled. COVID hospitalizations rose briefly before Christmas, after Christmas, only to fall again. Now, note, when we talk about media literacy, so they're at the hospital and they're overbooked, right? So much so that they have so many patients overflowing into the into the hallways and into the playrooms. And then the very next paragraph is like, well, there was no surge. So, okay. So it got so bad that hospitals were putting patients in the hallway. And then the next thing, then no surge. There was never a surge. What? What? Because it didn't get worse? That means there's no surge? So it was really fucking horrible. It was really bad. And they thought, man, if it gets worse, we're fucked really badly here. But it just stayed really bad. There's no surge. Yo. It's funny. I mean, it's funny. This is just funny shit. I don't know what to tell you. Not to mention, of course, big key differences between this year, this winter, and last winter is that insurance companies aren't paying for things like COVID anymore, right? And they're definitely not paying for flu or RSV infections. So people are less likely to go to the hospital. People are more likely to die at home. There's been a lot of people that are dying at home from sickness, or, you know, there's a lot of people that would otherwise be hospitalized, but because they don't have access to health insurance, they're not being hospitalized. They're just riding out their sickness at home. And that's happening all across the country, but you can't measure that with hospitalizations, right? So, but anyway, let's keep going. Quote, "We are seeing the normal busy, but not the very busy that I thought we would see," said Juan Salazar, physician-in-chief at Connecticut Children's in Hartford. "I'm just so pleased we're able to back to normal staffing, busy staffing, but not anything near what we saw in the fall." Now, again, they're very busy, right? They're barely, this is the big problem here, is hospitals, right, are usually understaffed, right? And so there's like, they try to staff hospitals with like a little bit of buoyancy so that during the flu season, because guess what? Even before the pandemic, we knew that 40,000 people a year would die from the flu, and that's what we based our hospital system on. Now, are we going to do anything to prevent people dying from the flu? No. The CDC, Centers for Disease Control and Prevention, they don't give a shit about preventing 40,000 people dying every year, right? So what happens when all of a sudden you have, I don't know, 300,000 people dying every year? 400,000 people dying every year from more viruses? Is that buoyancy is blown the fuck open, right? And so what happens is these hospitals get used to operating at like 130% capacity, 140% capacity, right? And so what they do is they've been having to hire additional staff, right? And so what was happening here is they're basing their metrics off of staffing, right? This metric here is busy levels. How many people per patient, or how many patients per doctor or nurse, whatever, right? And so when you're expanding and things are getting worse over time, right? We have higher lows. That means the non-busy periods are just busy all the time, which means the surges are extremely busy, and it destroys people's ability to really interpret what normal is, right? We are so far removed from whatever normal would be. If we want to use normal, would be 2019 levels of hospital, people in the hospitals and staffing and all that levels, right? We are very far away from that. We are orders of exponential magnitude higher in all the categories. Now, again, it's not as bad as it was, before we had a vaccine, right? When we didn't know what was going on. But I also want to let everyone know that 83% of the country are anti-vaxxers, right? Most of the country doesn't have good health insurance, right? And another metric is that sick days have more than doubled. People calling in sick from work has more than doubled this year compared to the year previous, right? So, I don't know. Maybe all of those metrics are a little bit more important than one hospital saying, it's not as busy as we thought it would be. I'm just saying, hey, I know it's wishful thinking. One hospital says, we thought it would be a little bit worse. So does that mean everywhere is all of a sudden fine? What? Well, anyway, let's keep going. Turns out the early waves of respiratory syncytial virus and influenza peaked before the new year, according to the new data from the Centers for Disease Control and Prevention. And the expected winter uptick of the coronavirus is nowhere close to overwhelming hospitals as it did in 2021 when COVID wards were filled with unvaccinated people struggling to breathe, blah, blah, blah. So nowhere close to overwhelming hospitals. Now, again, this is like the fourth paragraph after they talked about a hospital that was overwhelmed, right? Okay, so it's nowhere close to overwhelming hospitals. Now, again, what metrics are they using for that? Right, well, we don't actually know because they're not citing anything. But based on my understanding of the media, they're probably using like a national metric, right? They're probably like, in the Northeast, a bunch of hospitals are extremely overwhelmed. But in the South, hospitals aren't as overwhelmed, so it evens out is essentially what I'm guessing their model is. Now, again, I'm guessing that that's their model because they're not telling us what the model is. They're just saying things. Let's keep going. 7-day national average of hospital patients testing positive for coronavirus had declined to 39,000 as of Friday after peaking of 47,000 around Jan 10. Now, why I asked you to bring out your phone earlier, it is January 23, right? So how do we know that the threat is fading? Because we saw one data point that's going downwards. Now, is it possible, right? Is it possible that it's going to keep going downward? Yes. But if you're going to say that the threat is going away because of one reversal, come on. Come on. Really? Really? And then also, what is the threat? Now, let's look at the headline again. Threat fades. Do we know what the threat is? Well, average readers are going to read this and they think the threat is getting sick. But then if you read the article, the threat is based around hospital capacity, right? So people are going to read the headline, the threat's fading. That means it's good to go out to the grocery store without my mask on, not knowing that threat is referencing the hospitals, which, by the way, they're very unclear about. And then you keep going, and really the only data point that they have that's an actual data point and not anecdotal evidence from one hospital that they found like a buddy on the payroll for is that there is one reversal. And data has gone down slightly. Now, again, is it possible? Usually, these kinds of surges, happen in the winter because it's the coldest in months like December, January, February. And when it's colder, diseases, viruses can flourish a little bit more. People are more likely to be inside and so forth. So it's very possible that the surge is going down. But we do know that these novel strains of coronavirus, as well as these different viruses, the flu, coronavirus, RSV going around at the same time, it can cause a lot of lingering issues. A lot of hospitals, a lot of people have said, and now again, hospitals, when we talk about hospitals, a lot of people would get sick, be hospitalized, and then just be sick at home for several months, but they're not hospitalized, and so therefore they don't count here, right? So factor this in as well. If you're hospitalized, it means you're on death's doorstep. You can get sick, Go to the hospital, they bring your fever down, and they send you home, right? And then you just ride out your sickness for God knows how long at home, and you're not getting data mined for information so that the Washington Post can tell everyone that there's no problem, right? So factor this stuff in when we talk about articles like this. Now, again, you show this headline to the average American, and they're going to think, oh, so I can go to the movie theater. I can go to a concert. This has no bearing on that at all. But again, the media is aligned with the Republican mantra of COVID does not exist. There is no COVID. And so literally at every point, they're going to downplay it at every point. That's their role. That's the role of the Washington Post. That's the role of the New York Times. That's the role of the Republican Party. That's the role of the Democratic Party. They don't want you to panic. They want you to get infected with a disease and die, and then no one will know about it, right? So again, now, is it possible that the so-called threat is fading? Now, what is fading, right? That is going away. Does that mean it's instantly gone? Not really. So is it possible? Yeah. But do we really know? And then also, what is our baseline? What's normal now? Right? The lowest point of hospitalizations throughout 2022 is higher than at any point in 2021. So the lowest point of hospitalizations is higher than in 2021 when the Delta surge happened. So, that's what I'm interested in, right? As far as threat fading, are we going to be higher than 2022 on average or lower than 2022 on average? Just curious. Anyway, so some food for thought there. Interesting article, I guess. Just a little interesting.